In today's video, I want to share an idea with you that can relate to how you take care of your body and how well and how healthy your lower back stays. Really not just your lower back, but also your entire body. There's two different types of what we call short leg conditions. I don't know if that's a term that I made up or a term, I'm sure that there's probably a technical name for it, but there's two different ways that one leg appears shorter than the other. So when we look at the spine and we look at the body, we look at the distance between the top of the pelvis and the bottom of the feet. And those two measurements, the distance here, should be the same on both sides. But that's not always the case. In fact, according to Dr. Tim Maggs, who's been in practice for close to 40 years now, and he works with Olympic and collegiate athletes, and he x-rays all of his athletes. He claims that up to 40% of people have one leg longer than the other. And at the time when I first heard this, I was thinking it was maybe closer to about 10%. And since that time, this was probably about 3 years ago, I started paying closer attention to the leg lengths of my patients. I fit people for orthotics in their shoes, and when there's a difference between one side and the other, it can make a huge difference in the way that you're walking, the way that the support for your lower back. If your legs are unlevel, then what happens is your pelvis can be tilted, and that can cause all sorts of problems in the lower back. But there's two different types of short leg conditions. So the first type is what we're going to call functional short leg. So a functional short leg means that the leg's not really short. Like sometimes this leg will be longer than this one, or this one will be longer than this one, but that's not the case. Usually what happens is there's some sort of twisting that happens at the base of the spine here, or a person can have some scoliosis here, and it causes the pelvis to twist. That's called a functional short leg, and some of those problems can actually be corrected. Every person is a little bit different, but finding a way to get those hips nice and level. Now, you may not know this on yourself, but one way that you can tell is if you stand in front of the mirror and you put your hands on top of your hips, you can see whether one hand is sitting higher than the other. I was with a woman this morning, and she has a short leg on one side, and when her feet are together, one hip is a little bit higher. But when her feet are apart, they're fairly level. So sometimes the body adapts to the position, and it's not uncommon that the legs will grow at different speeds, different times. And so that's the first type, which is called a functional short leg. The second type of short leg condition is called an anatomical short leg. And what that means is that the anatomy of the bones is a different length. So sometimes what happens is you can have this bone is longer than this bone, or this bone is longer than this one. And when that happens, or sometimes the height of one side of the pelvis is a little bit higher and this one's a little bit lower. And what that does is causes an imbalance and a shift in the support for the lower back. As I've mentioned in other videos, that low back disability is the number one cause of disability in the world. Well, this is part of the problem or the challenge that we have as people to make sure that our body and our spine is well supported. Now, interestingly enough, because the body is super intelligent and it's trying to do the best it can with what it has, sometimes what happens is you have this bone is longer than this one, but this one is longer than this one, and at the bottom, it ends up being level. But what that can do is cause it so that when a person is walking, that they're not walking evenly and things are imbalanced. And so it's important, the important part of this conversation is to know, number one is this happening to you? Now, this can happen even if you don't have any other problems. If you have a habit of crossing your legs, you're walking in bad shoes, you're walking on concrete or tile floors, any sort of compression on the feet and on the legs and on the body, when it's a hard surface, is going to cause more compression there. but we can begin to start to make a better change in the body. And so part of this as a chiropractor is to help to level those hips, to make sure that the body is nice and balanced all the way down, that your alignment is nice and straight. Because when the pelvis gets twisted, what that does is it causes a weakness in the lower back. Now, as we explained in a previous video, that sometimes there can be weakness in the lower back because the ligaments that hold our bones together. So ligaments hold our bones together, and if the ligaments are not holding our bones together, then the pelvis can begin to twist. If there's weakness in the lower back, part of what happens with that is it causes direct pressure on the discs in the lower back, because your L5 disc, which is the disc that's most prone to problems in the entire human body, sits right above the pelvis. It's right in here. And so right in here. And when we have weakness inside these joints here, it causes, the disc is the softest part of the spine, and can be shifting in the pelvis, which then starts to wear on the disc. So not only is it just so that our body is straight, but it's also so that our spine ages better, so that we live better, so that we can stay active longer, so that we can take care of ourselves and really participate in the way that our body wears over the course of our life. So just as a quick recap here, two different types of short leg conditions: anatomical and functional short legs. This can happen to anybody. It happens to me, happens to my wife, happens to my kids. It happens really to everybody, but you may not be aware that this is happening to you. Now, one of the indications that there is some sort of twisting in the pelvis, and we spoke also about this when we were talking about sacroiliac problems, is that a lot of times the problem shows up more on one side than the other, okay? Especially when the pelvis is getting twisted. So what I recommend is go see a chiropractor in your town. Go have your alignment checked. Not all chiropractors are really familiar with how to best stabilize the lower back and get it straight. Sometimes they'll be able to identify that there's an actual twisting going on, but they may not know actually how to correct it. So anyway, that's one of the things that we do here. We fit people for orthotics, help people to develop good habits and ergonomics in their work, so that they're sitting and moving and bending and sleeping during the day, so that they're taking care of their body, that they're not causing undue stress on different joints in their body, and so that you can live your life better, age better, live healthier, stay active longer, and really enjoy your life as much as you possibly can. I hope this is helpful for you. If you have any questions, please put a question in the comments below. Hope you have a beautiful day. Thanks so much.